What's up, everyone? Welcome to my channel. My name is Alicia Williams. I am a licensed practical nurse, and in today's video I'll be going over part 2 of Correction Nursing 101. So if you consider working in the correctional system as a nurse, you have come to the right place. I have worked in over 10 jails over the last 3.5 years as a staff nurse and as a travel nurse. So I am a licensed practical nurse. I live in Pennsylvania, Philadelphia, and I'm also a certified personal trainer, and I'm also a certified nutrition coach. So if you find my content of any value, please consider subscribing to my channel. Please give this video a thumbs up and leave me a comment. And if there's anything that you want to know about correction nursing, please reach out to me. So in part 1, I talk about the different types of correction facilities. I talk about the do's and don'ts of corrections nursing, and in today's video I'm going to be sharing basically what the role of the nurse is in correction system, what your roles are. So within the correction system you have LPNs and you have RNs. So it all depends. Now, the first part of nursing in the jail is intake. Intake is the first part of the jail. So intake is when the inmates come in. They have to be seen. They have to go through an assessment by the nurse. So you're given an eye in them. You're asking them the questions. Are you okay? Do you have an injury? Checking their vitals to make certain that they are fit for corrections. If there are any issues, you got to send them to the hospital. They have wounds. The second part, and then the second part of intake is when they actually comes in. You are sitting them down and you are going over the mental health evaluation form with them. You're doing a PPD, full set of vitals, weight, and you're doing a urine and drug test. And yeah, now some jails that I've worked in, only the RN does intakes, and then some jails that I've worked in the LPNs do intakes, and some jails they have medical assistants that help the RNs with intake. So it varies depending on the jail, right? Number 2, after intake, you're going to have the bulk of your duty as a nurse is going to be the med pass. The med pass. And so, as I said, every jail is different. I've worked in 10. I've worked with 3 different companies, and every company is different. So the med pass, there are 3 main systems that we use. We have Core EMR, which is my favorite system. That's the easiest system to use. You have HCS, Healthcare. I forgot. That's horrible. I hate it. And then you have Centric. And so, but Core EMR is the best. Number 2, the MedPass is different. So some jails you have, so the jail is always going to be in alphabetical order. So you're going to be assigned to a specific unit, right? So you may have A, B, C, D, and then you may have A1, A2, A3, and A4. So some jails you may have to go to the unit itself, like you go to the cell, in the front of the cell door, and you stand there and you say med pass medication, and the inmates come to the med cart, and a CO is supposed to be there with you all the time while you're doing your meds. But as I said, I've worked in jails where there was no COs, so understand that you may have that challenge. So therefore the med card is between you and the inmates, right? So you're blocking the door with the med card. The inmates, the COs are in the bubbles. They come to you. They are supposed to have their IDs. If they don't have their IDs, you can tell them, go back and get your ID, because inmates, they are tricky. They are very, very tricky, right? And so you pull the meds. So when it comes to the med pass, every jail is different. So you're looking at around 100 to 250 inmates. I'm not trying to scare you, but I want you to understand that the medication pass in the jail are nothing like long-term care facility and hospitals. You go have a very high med pass, so the inmates are going to come to you to your cart. That's first. You go to them. Some jails, they have what is known as a dispensary. Dispensary is a little tiny room, which I do love the dispensaries. And the inmates come to the dispensary. You're in the dispensary. They come to the dispensary window. And so every block has a dispensary. They come to the dispensary, and it's a big glass, and there's a small hole, and there's a little thingy that you push the meds under. So you're not really interacting with them, like they're not breathing in your face, right? And so yeah, so when it comes to the meds that you're going to be giving out, most of the meds are going to be your psych meds, your Seroquel, Ramaran, Sertraline, Zyprexa. Zyprexa is like candy. And so on. Second in line, you're going to have a lot of hypertensive, a lot of diabetic meds, because there's a lot of them in there. And then you may have some special meds. Every now and then you may have an inmate that gets anywhere from 5 to 10 medications. Yes. Now, the med card. So every jail does their med card differently. You may end up in a jail that has a crappy ass med card. So the first jail that I worked in, the med card was a mess. So the way how the med card is, they have their own pharmacy. And so you stock your med cards. But the way how the med card is set up, it was crazy. They have generic name, brand name. So say, for example, atorvastatin, you would think it would be an A, it's an L. So you have to know the generic and the brand names, because you're going to be struggling if you don't know the names. Like, it's crazy. Seroquel is quetiapine. It's not in Q, it's in S. Ramaran, Martezapine is in R. So the medications are all over the place. So if you don't really know, you might struggle. Also, every jail is different. Some jails you may have to crush all the psych meds, and you may have to pour it in a cup with water and they drink it. Some jails, they don't. You just give it to them. They have to take them. Just give the cup to them. They are supposed to take the med in front of you, right there, and that's a CO is supposed to be there to make certain that they're taking their meds, because you have to make certain, because suicide is a big thing in the jail, and if somebody's planning on hurting themselves, they will stop the meds, they will cheat them, they will do anything with the meds. You have to make sure that they're taking the meds. There are some inmates who are caught cheating meds. Their meds may have to crush, so be very mindful of that. Also, that's basically it with the med pass. There's not med pass is for it. Oh, another part of the med pass is you may have another med pass where other jails, they may have patient specific, so each inmate may have their own cards. And then I worked in this jail in Florida, and it's crazy. They had bottles. I have never seen bottles. I've seen cards, but they had little tiny bottles. Everything is in bottles. And so it was crazy. There's no patient specific except for a few medications. And so you're going to have to screw the bottles off. It was crazy. But, once you start your med pass, you learn your rhythm and you get it going. Now, the jail have lockdowns. So lockdown for count. So you may out there doing your meds, and you may have a lockdown. The timings for medication pass varies from jail to jail. So you have a morning med pass. Normally it starts, some jails start at 8 o'clock. Some start at 9. I've worked in a jail that start their med pass at 10, right? And then you may have an afternoon med pass, which might just be insulins. Now the evening med pass, which is the night med pass, is going to be your heaviest med pass, and it's going to be at around, depending on the jail. I've worked in jail where I start my med pass from 5 o'clock, from 4 o'clock, and some jails, they specifically want the med pass to be between 6:30 to 7, and then most jails have a count at 9 o'clock. So when the count is going on, you cannot be out there giving your meds. That's basically when they count the inmates and send the count to shift command. So be mindful of that. Now, I think that's it for the med pass. Now, let's move on to the second thing you're going to be doing is detox checks. Now, detox check is a big thing in the jail. Now, most inmates come into the jail, they're on something. whatever the thing is. And so when they come into the jail, they're supposed to go through a detox protocol. Every jail have different detox protocol, different medications for detox. For the most part, the last jail I worked in, they were on, they got Keppra 500, clonidine. So all of these medications are basically used to monitor the seizures. So detox checks are done twice a day, morning and evening, and you're doing your vitals, standing and sitting down, and you're checking for any symptoms, dehydration, whatever, whatever. And that's for the detox checks. The next thing you're going to be doing like blood pressure checks, wound care, and then you're going to be doing like mental health unit. You're going to do MHA rounds. Yeah. Now some jails may have county jails may have infirmary. If you're in the infirmary, that's a whole different thing. That's a whole other video I'm about to do for the infirmary. But most part, that's basically most of it in the jail. Oh, one more thing, apart from the med pass, apart from the detox checks, apart from triage or sick calls. So whenever the inmates want anything, so when you're doing your med pass, they're gonna come and they ask, can I get some Tylenol? Can I get that? No, they can't have it. Tell them to put a sick call in, because once you give them one time, child, they're gonna come every night for it. So tell them to put a sick call in. Once they put the sick call in, they said the law states we got somebody got to see them within 24 hours to see what the problem is. So you're gonna do sick calls. It's basically a quick assessment, what you need, what you want, and you'll be surprised to see what they put a sick call in. I need milkshakes because I'm losing weight, so I need a double portion. So sick calls, another thing that you may have to do. The next thing you're going to be mindful of is medical emergencies. So medical emergency, you're going to hear it announced, medical emergency, and so and so, in this unit, block 1, whatever. Now, when a medical emergency, you have to leave everything you're doing, and you have to run. Run to medical emergency. Everybody has to run. So if you're in medical, you have to take the bag, we have a bag, a stretcher, a wheelchair, and oxygen to where the medical emergency is. Sometimes it's medical emergencies and sometimes they're crap. I've gone to medical emergency and I'm running like I'm crazy and I got there. What's the problem? Oh, I sprained my leg. And I'm like, you had to, that's not a medical emergency. So the medical emergency, they can be crazy. It's a lot. So those are some of the stuff that you will be doing in the jail. It is not as bad as people make it seems to be. As I said, every jail is different. Every med pass is different. You just have to find your routine. Once you get your routine, you get your stuff down, you will be fine. I mean, to me, the jail is the safest place to work. Because I've never had any issues. Once you respect these inmates, they'll respect you, and you'll be surprised to know that these inmates, they protect their nurses because they want their meds. Some of them they don't even take the meds while they're on the streets. The moment they come to jail, I want my meds. So I mean, corrections nursing is a calling. It's not for everybody, but it's not for everybody, but it's a rewarding career. So if you make it this far, thank you so much for watching and have yourself a wonderful day.